Thank you, Mr. Chairman. Continuing on this 4E issue, obviously, the state of Washington has utilized the 4E waiver for an initiative we've called differential response, which is intervention designed to prevent families and children from entering the foster care system where it can be avoided. The program allows investment to keep families together, counseling, support services, so that foster care is not the first response. So obviously we worked with Chairman Hatch on this in the Family First and Prevention Services Act, which was included in the budget 2 years ago. So if confirmed, will you commit to continuing to help the implementation of the 4E waivers?
Thank you, Senator Cantwell. Yes, my county is also a differential response county, and the primary prevention efforts that are done to help families stay strong and healthy are the most important efforts that we can make so a child doesn't enter any system. And so I'm very supportive of the 4E efforts to wrap around a family to keep them strong.
So do you support helping other states to utilize this fund for prevention programs and services?
I would follow the law in accordance with the Family First Act to use these funds.
Okay. Yes, okay. We're going to keep innovating. That's the key thing in Washington, the state of Washington. We're going to keep innovating, so thank you for your help on that. The speaker has talked about welfare reform, and that's his next focus. What would you do as far as reforming these programs?
Thank you, Senator. The welfare reform efforts have been successful, but they are over 20 years old. Economics have changed, and the individuals that we serve are looking to stand on their own 2 feet through employment, and what I see today is multiple employments. More individuals seem to be walking into our offices not unemployed, but low employed. And so the incomes they are making are still not enough to move them out of government systems. So what I would like to see with the welfare reform is more integration with the systems that are in all other agencies other than HHS and ACF, in addition to working more with the communities. I would also like to look at the relief of administrative burdens on the local and state agencies that we spend a lot of time on, rather than looking at people in the eyes and helping them to move forward in a successful way. I'd like to look at outcomes that are driven around the issues of poverty more than just a work participation rate. Employment is critical, training is critical, education is critical, reduction.
What about housing?
Housing is probably one of the biggest issues I'm dealing with in my community today. Housing first. It's hard to get a job when you're living on the streets, so looking at the housing issues and looking at the health issues. The social determinants of health and well-being of a community also impacts an individual. So I would like to look at the whole picture and measure those outcomes, not whether we're being compliant, but whether we're actually moving to success and people are standing on their own 2 feet, and maybe even 2 years after they're out of our system.
Well, maybe if you are successful, you could have a moment with Speaker Ryan, because I don't think he gets the housing crisis that we're in. And just as your state's been successful, the chairman's state has been successful with housing veterans. My state has had great success. The complexity of everything from workforce issues to returning veterans to all of the, it's so clear that housing stabilizes and increases the income potential of these individuals and gets us out of our cost scenarios as well when they don't have a safe place to be. So how we get this across to our House colleagues, I just don't know. You've said it well. It's an investment that needs to be done in conjunction with these programs. You need to look across these other sectors, but couldn't agree with you more. Housing is a very big issue right now, but unfortunately our House colleagues just don't seem to quite understand how critical that issue is. So thank you very much.